Ever feel like you need a medical dictionary just to understand the news these days?
Right.
Well, today we're diving deep into a treatment you've probably heard of, but might not fully understand: high-flow oxygen therapy.
Or HFOT for short.
Exactly. And we're going beyond the headlines with these super detailed clinical guidelines from Bart's Health NHS Trust.
These guidelines are like the instruction manual for HFOT.
They give us a backstage pass to how hospitals are using this cutting-edge tech to help patients breathe easier. So, no more mystery. Let's break down HFOT. For those of us who don't speak doctor, what exactly is high-flow oxygen therapy?
Okay, picture this. Remember those nasal cannulas you see on patients in like every medical show ever?
Yeah, those little tubes delivering oxygen.
Exactly. HFOT uses a similar system, but it's like the supercharged version. We're talking warmed, humidified oxygen delivered at a much higher flow rate than traditional methods.
Higher flow rate, meaning?
Meaning it can actually exceed the patient's own breathing.
Wow, exceeding their breath. That sounds intense.
It is, but in a good way. This high flow is essential because it helps get a higher concentration of oxygen into the bloodstream, which is crucial when someone is struggling to breathe.
So it's like giving their lungs an extra boost when they need it most.
Exactly. And the guidelines dive into the specifics of when this boost is most effective. For instance, they talk about using it for severe hypoxemia.
Hypoxemia, that's low blood oxygen, right?
You got it. They also mention using it after someone's been on a ventilator, or even when thick lung secretions make it hard to breathe.
It's like HFOT is the go-to in those critical moments when every breath counts.
Exactly. And this is but HFOT isn't a magic solution for every breathing problem.
Right, it's not a one-size-fits-all solution.
The guidelines are crystal clear that it has to be the right tool for the job. And just as important as knowing when to use HFOT is knowing when it's not appropriate.
So when is HFOT a no-go?
Well, for example, if someone has, say, epistaxis.
Epistaxis. Hold on, gotta brush up on my medical terms.
It's a nosebleed.
Ah, okay. So no blasting high-flow oxygen up the nose during a nosebleed.
And another important point is that HFOT is not a replacement for a ventilator if the patient needs more intensive support.
So it's all about choosing the right tool for the job, like you said.
Precisely. And speaking of choosing the right tool, the guidelines actually compare HFOT with other oxygen delivery methods.
Oh, like what?
They compare it to your standard oxygen masks, nasal cannulas, even more advanced options like non-invasive ventilation.
They lay out all the options, so how do doctors decide which way to go?
Well, it's not just about which device delivers the most oxygen.
What else comes into play?
Patient comfort is a big one.
Because who wants to be stuck with an uncomfortable mask?
Right. They also think about the patient's ability to eat and speak while receiving oxygen.
That makes sense, especially for longer-term use.
And even the psychological impact of different devices is considered.
Psychological impact? How so?
Well, imagine wearing a tight-fitting mask for a long time. It can be claustrophobic, anxiety-inducing, and that stress can actually make breathing worse.
That's so interesting. They're really thinking about the whole picture, not just the technical aspects.
Absolutely. And this meticulous, patient-centered approach is evident throughout the guidelines, especially when it comes to patient safety.
Right, because we were talking about pumping high-flow oxygen here. That can't be risk-free, right?
You're right. There are inherent risks, but the guidelines address them head-on. They're really big on careful patient selection.
Making sure it's the right fit for the patient.
Exactly. And then, once HFOT is underway, they stress the importance of ongoing monitoring.
So it's not just a matter of setting it and forgetting it.
Not at all. We're talking about regularly checking oxygen saturation, monitoring their breathing, making sure the nasal cannula is positioned correctly to prevent pressure sores.
There's a lot of hands-on care involved.
Absolutely. It's not just about the technology. It's about using it carefully and responsibly. And to ensure that happens, they even have these flowcharts.
Flowcharts, like visual aids.
Exactly.
What's the advantage of using those in a hospital setting?
Think of them like step-by-step guides.
Okay.
They make sure everyone's following the same clear procedures for HFOT.
Ah, so it's all standardized.
Exactly. From the initial setup and monitoring to troubleshooting any hiccups.
Right.
It's all laid out to minimize errors and ensure consistency.
So it takes the guesswork out of it.
Exactly.
Yeah.
And they even have these like detailed steps on what to do if a patient's condition goes downhill.
Oh, wow. So it's like a contingency plan, too.
Exactly.
Yeah.
It shows them how to react quickly and when to call for backup if things get really serious.
That's reassuring to know they have a plan for everything.
Which makes me think, all this requires some serious know-how, right?
Oh, absolutely. We're not talking about just pressing a button here.
Right. It can't be that simple.
Not at all. In fact, the guidelines dedicate a whole section to the skills needed to administer HFOT.
Oh, there's like a training manual within the guidelines?
Pretty much. It's a whole checklist of competencies for healthcare professionals to make sure they're up to speed.
Makes sense. They don't want just anyone handling this stuff.
They need to understand the science behind it, how to operate and troubleshoot the equipment,
Of course.
when to call for help if things go south, even how to clean and disinfect everything properly.
Can't forget about infection control, especially in a hospital. Absolutely. Can't emphasize that enough. Keeping things sterile is paramount, for obvious reasons.
And it's fascinating how these guidelines don't just focus on the technical stuff.
You're right. They also address that human element of care.
Oh, interesting. How so?
Well, for instance, when deciding on the best way to deliver oxygen to a patient, it's not always about which device pumps out the most oxygen.
Right. There's got to be more to it.
Exactly. They actually compare HFOT to other methods we talked about earlier. Standard oxygen masks,
Right.
nasal cannulas, even those more advanced options like non-invasive ventilation.
So they're weighing the pros and cons of each.
Exactly. They consider patient comfort, their ability to eat and talk while hooked up.
Oh, yeah, that's got to be tough.
Right. And even the psychological impact of these different devices.
Psychological? What do you mean by that?
Well, put yourself in the patient's shoes for a second.
Okay.
Imagine wearing this tight-fitting mask for hours on end.
Yeah, I can see how that would be a bit much.
Right. It can be claustrophobic, anxiety-inducing, and that stress. It can actually make breathing even harder.
It's like a vicious cycle.
Exactly. So the guidelines highlight all these nuances, emphasizing a patient-centered approach.
That's good to hear, treating the whole person, not just the symptoms.
Precisely. And speaking of treating the whole person, they really hammer home the importance of constantly checking in on the patient throughout HFOT.
So it's not a set it and forget it kind of deal.
Nope, not at all. They're adamant about continuous checking oxygen levels, making sure their breathing's okay, the whole 9 yards.
Wow, they're really on top of it.
They are. But it's not just about reacting to problems after they pop up.
It's about prevention, too.
Exactly. They emphasize proactive communication between everyone involved.
So, like making sure the doctors, nurses, everyone's on the same page.
You got it. They highlight regular check-ins between doctors, nurses, respiratory therapists, even physiotherapists if needed.
It's a real team effort.
Absolutely. Everyone's working together to make sure the patient gets the best possible care.
That's good to know, but these guidelines are tailored for a specific hospital and their resources, right?
It's true.
So how much of this applies to other healthcare settings? Like, what about hospitals in other countries with different setups?
That's a great question. And it's important to remember that while specific protocols might differ,
Right.
like what equipment they have available, the core principles of HFOT, when to use it, why it's used, the focus on patient safety,
Yeah,
those are universal.
that makes sense.
These guidelines offer a framework, a way of understanding not just the how-to of HFOT.
But the why?
Exactly.
Right.
And that knowledge is crucial for any healthcare professional dealing with respiratory care, no matter where they are in the world.
It's like having a global standard.
Precisely.
Amazing. Well, we've covered a lot of ground here today. We've talked about what HFOT is, how it works, the insane level of care involved, the potential risks,
Right.
even the training needed for those handling this stuff.
Absolutely.
But there's one thing we haven't touched on yet.
And that is,
What happens when a patient's condition improves? How do they transition off HFOT?
that's a critical part of the process. And you guessed it, the guidelines cover that too.
I knew it. They thought of everything, didn't they?
They really did.
So when it's time to wean a patient off HFOT, it's not like ripping off a Band-Aid, right?
Definitely not.
There's got to be a gradual process.
You're right. They can't just yank it off. It's definitely more of a slow and steady approach.
Okay, so how does that work exactly?
Well, the guidelines recommend this gradual, step-by-step method.
Okay.
They carefully adjust the oxygen concentration and the flow rate over time.
So it's like fine-tuning a dial rather than just flipping a switch, right?
Exactly. They'll usually start by lowering the oxygen concentration first,
Okay.
and they're watching the patient really closely to see how they respond.
Of course, making sure they're stable.
Exactly. And once they're doing okay with the lower oxygen level, then they start decreasing the flow rate bit by bit.
Oh, so it's a two-step process.
Exactly. The goal is to transition them smoothly, either back to just regular oxygen therapy,
Okay.
or maybe even no extra oxygen at all, if they're ready.
Wow, so they could come off it completely.
If all goes well, yep. But of course, they're always prepared to adjust things if the patient starts struggling.
Right, better safe than sorry.
Absolutely. Speaking of safety, There's one thing people often get wrong about oxygen therapy.
What's that?
You know how everyone thinks oxygen is flammable?
Well, yeah.
It's not actually the oxygen itself that burns.
It doesn't.
Nope. It's more like, think of oxygen as adding fuel to an existing fire.
So it makes a fire worse.
Exactly. It's all about the presence of a spark or flame.
So I'm guessing no cigarettes while on oxygen therapy.
You got it. And the guidelines are really strict about this.
Yeah, they wouldn't want to risk it.
Not at all.
Yeah.
They talk about making sure all the electrical equipment is grounded properly,
Okay.
avoiding static electricity, things like that.
It's all about minimizing any potential risks.
Exactly. And speaking of risks, there's one they highlight that I wouldn't have thought of. HSOT can actually hide the signs of apnea.
Apnea, that's when someone stops breathing, right?
That's right.
How could HFOT mask that? That sounds kind of scary.
Because HFOT is pumping in such a high flow of oxygen, even if a patient momentarily stops breathing on their own,
Okay.
their oxygen levels might still look normal for a short period.
Oh, wow. That's tricky.
Exactly. It's why they're so insistent on continuously monitoring breathing patterns throughout the therapy.
So those alarms and monitors are there for a reason.
They're essential. It's a good reminder that technology, while super helpful, can't replace a trained professional who can interpret those signs and react quickly.
Absolutely. They're the ones who connect the dots.
Exactly. And speaking of trained professionals, the guidelines even outline what to do if, say, a patient on HFOT needs to be moved to another part of the hospital.
Oh, right, because you can't exactly wheel those big HFOT machines down the hallway in an emergency.
Precisely. It's tricky, right?
So what do they do?
Well, if possible, they'll try to switch the patient over to a more portable oxygen delivery system.
Like one of those oxygen masks with the reservoir bag?
Exactly. Something they can easily move with the patient.
Makes sense.
But again, the big emphasis is on having the right equipment and qualified staff ready to go during the transfer.
Right. It all comes back to patient safety.
Always the top priority.
This has been amazing. We've learned so much about high-flow oxygen therapy, what it is, how it works, all the meticulous steps involved.
That's a lot to take in.
It really is.
Yeah.
And it's incredible to see the level of detail and care that goes into something we often take for granted, breathing.
It really makes you appreciate the work of those healthcare heroes, doesn't it?
It absolutely does. Well, that's all the time we have for today's deep dive into the world of high-flow oxygen therapy,
We hope you found it as fascinating as we did.
and that it's given you a newfound appreciation for the power of medical technology when used safely and effectively. Until next time, keep exploring.